Uh, I'm so happy to be with you. This is my lecture regarding the exploring mechanical change in the transversus abdominis muscle following cesarean delivery in postpartum women. Just a moment. Yes. My name is Mohamed Gamal Shehata. I am a lecturer of physical therapy for women health at South Bend University, Egypt. Associate alumnus at Harvard Medical School, the USA, licensed physical therapist, New York, the USA, and former PhD researcher at the School of Rehabilitation Therapy, Queen's University, Ontario, Canada. Those are the authors for this research paper. It is a part of my PhD thesis. I will represent the paper now. Background, cesarean delivery is the most frequent major surgical operation performed globally, involving the delivery of one or more fetus through incisions made in both the abdomen and the uterus. There are two types of abdominal incisions, longitudinal and lower transverse, with the latter being the most commonly used. The lower transverse incision allow access for the rectus abdominis separation after the sharp incision through the myofascia of the internal oblique, external oblique, and the transversus muscle, the core muscle. The cesarean delivery rate continues to be of a global concept because of its constant rise. According to the Central Agency for Public Mobilization and the Statistics of Egypt, the rate of cesarean delivery has increased to reach about 72% of all deliveries in 2021, up from 52% in 2014. This put Egypt on the top of the people which perform cesarean delivery, the first globally. The high cesarean delivery rate in Egypt may be partially due to financial incentives, as cesarean delivery tends to receive higher reimbursement than vaginal delivery. Other factors contributing to this increase in the cesarean delivery rate may include maternal overweight, obesity, and obstetricians' preference for managing their time, as uncomplicated cesarean delivery can be completed in a relatively short time compared to vaginal delivery. One of the local and deep muscles, core muscles, is the transversus abdominis. Activation of the transversus abdominis generates a mild increase in the intra-abdominal pressure, which helps to relieve stresses on the spine. The delayed activation of the transversus abdominis muscle is associated with different musculoskeletal disorders, like chronic low back pain. Both cesarean delivery and pregnancy contribute to the weakening of the transversus abdominis. Despite either pregnancy or pregnancy-related adaptation, most of this adaptation revert to the pre-pregnant state by the end of the period, which end by the sixth week postpartum. The aim of this study was to assess the maximum voluntary isometric contraction, MVIC, of the core muscle, the transversus abdominis specifically, among women undergoing cesarean delivery and compare it with those undergoing vaginal delivery and those without previous pregnancy. This is the transversus abdominis muscle, and it is a transverse sheet which will assume mechanical changes after cesarean delivery, and this will be considered in this paper. And actually, pregnancy also may put a pressure on the transversus abdominis, so it also may contribute to the weakness of this muscle. Methods of this research: the study design was a historical retrospective cohort design. Participants were 95 women classified into Group A, 40 women who underwent cesarean delivery. Group B were 15 women who underwent vaginal delivery. They represented the control positive group. The limited number of this patient or these participants was due to the reduced rate of vaginal delivery in Egypt nowadays. Women in these two groups were assessed at 6 to 12 weeks postpartum to be ensured that, or to be in the to be assured that we passed the periperium. The periperium. So many of the anatomical and physiological changes during pregnancy and childbirth will revert to its normal pre-pregnant status. However, not all will be returned like what we will see in this paper. Group C were 40 women who never experienced pregnancy. They represented the control negative group. The pressure biofeedback device was used to measure the maximum voluntary isometric contraction of the transversus abdominis. So what about the inclusion criteria and exclusion criteria? Inclusion criteria: women aged exclusively between 18 and 35 years old, body mass index below 30. Participants were not involved in any physical training program. It is very important part when we selected our patient or participants, that they are not involved in any physical training program. And the exclusion criteria were women unable to complete the assessment process, obese women with a body mass index greater than 30, women younger than 18 years old or older than 35 years, women with a specific low back pain related to known dysfunction such as lumbar disc prolapse, scoliosis, or spondylolisthesis, as we know that core weakness may be linked to low back pain. The pressure biofeedback unit is a valid and reliable device to measure the transversus abdominis maximum voluntary isometric contraction, which will be the considerable measure for the mechanical changes in the transversus abdominis strength. For assessment, this is the pressure biofeedback unit, and this is the method we do it while we take the measurements of the transversus abdominis MVIC. For assessment of the transversus abdominis stress, the subject was seated upright against the chair back, one hand on the gug, and both feet were resting on the floor. The pressure biofeedback cell was fitted to the lumbar spine. This is the cell. And to contract the transversus abdominis, the subject slowly drew her lower abdomen toward the back. It's called abdominal drawing in maneuver. To measure the transverse abdominis MVIC, the subject was encouraged by the researcher and asked to hold the transversus contraction for 10 seconds while maintaining the increase of 2 to 4 millimeter mercury. The researcher palpated the abdomen just medial to the anterior superior spine to feel the transverse activation. The average of 3 consecutive readings was recorded. The results, we used a for quantitative descriptive statistics data, we used the median and interquartile range for the physical characteristics of subjects like age, body mass index, postpartum duration in weeks, and number of deliveries, and the transversus abdominis MVIC. The Kruskal-Wallis test was used for the mean rank comparison of the dependent variable among the 3 groups, and Ponferroni test or post hoc test was utilized for pairwise comparison if the Kruskal-Wallis test indicated significance. The Kruskal-Wallis test revealed a significant difference in the transversus abdominis strength among the 3 groups. The Ponferroni test showed significant difference in pairwise groups. The group of cesarean delivery and the control negative, there is a significant difference. Between the group of cesarean delivery and the vaginal delivery group, there was a significant difference. However, there was an insignificant difference between groups of B and C, vaginal delivery and the control negative, the p-value was non-significant. This is the table and the figure, Cross-Wallis test and post-hoc test among the three groups, like what you are seeing. Group A, the median and the quartile range, the median was that the patient can only be able to increase the pressure about 2.7. And in group B, the participant can maintain their contraction in the transversus abdominis about 4 to increase the MVIC about 4 millimeter mercury. And in the group C, the negative control group who didn't experience pregnancy can increase and maintain for the 10 seconds an increase of 4 millimeter mercury. The p-value indicated 0.001, so it is highly significant ratio. There is a pairwise comparison for this is group the the cesarean delivery, and this is the vaginal delivery, and this is the control negative group who never experienced pregnancy or delivery. So we can notice that there is no significant difference here. However, there is a significant difference between here and here. Conclusion of this part of my PhD thesis: even after the end of the peripartum, women undergoing cesarean delivery exhibited a remarkable decrease in their transversus abdominis strength, compared to those undergoing vaginal delivery or those of the control negative group. On the other hand, an unremarkable decrease in the transversus strength was found in women of the vaginal delivery group compared to those of the control negative group. Cesarean delivery may be associated with weakness of the core muscle, specifically the transversus abdominis. Future studies with larger sample size are encouraged to improve the generalizability of these findings. So what about the home message? When women who underwent cesarean delivery at 6 to 12 weeks postpartum may show weakness in the transversus abdominis, which is one important local core muscle participating in spinal stability. 2, encouraging vaginal delivery is advisable because it was associated with a statistically non-significant decrease in the transversus abdominis strength compared to those who had never been pregnant. For those who are eligible for cesarean delivery, a focused exercise program within the physiotherapy care is important to improve the transversus abdominis strength and should be considered during both antenatal and postnatal periods. So these are the references. And thank you.